Right. Well, thanks again for joining us tonight as part of our virtual information sessions. I'm excited to be joined by two current fellows that you'll get to hear from. And in fact, I'll go ahead and let them just tell you a little bit about who they are. And then later they're going to tell you more about their projects as well. Tanya?
Hey, so my name's Tanya Correya, and I'm a second-year medical student at UAB School of Medicine. And my community site partner for my project is Girls Inc.
Hey, I'm Carolyn Grace. I'm a third-year dental student at UAB School of Dentistry, and I'm doing a partner project with ASF that deals with the special needs population in dentistry.
Hey, yeah, so I would love to share about my project. I guess mine is a little bit different because coming into ASF, I had already done a little bit of work about the topic that I wanted to do. And so the main thing is that my project aims to address the lack of access to feminine hygiene products in Alabama, especially in schools, middle schools, and to address the lack of access to menstrual care education. And so I had done a little bit of work by working with the school before ASF, and what ASF helped me to do was expand that project and partner up with a community partner like Girls Inc. And that really helped me to kind of think about adding the feminine education component to it. And so that's what I've been doing for most of the time now. Over the summer, I worked mainly with Girls Inc. And right now I'm expanding to more schools. And so we're currently in talks of, scheduling and things like that. But the main thing is that, the cost of these products, menstrual care products, are really high, especially for students that come from struggling families. And so the goal of my project is to help ease the transition into puberty and to help boost confidence in girls as they are, growing into women, basically. And yeah, my project, so at the beginning of the ASF project, so we set goals for ourselves. That way we can hold ourselves accountable and kind of, have a direction to work towards. Of course, we always have the option of modifying it a little bit because along the way, there's going to be different challenges that come up. And so it's super important to be adaptable to, change directions when needed, and to ensure that you can reach your goal by the end. And so my main thing was that over the summer, I worked on creating a program with Girls Inc. So I was able to pilot that with the girls at Girls Inc. before expanding that to the other schools. And I also put together a resource list that I can share with the girls and their parents so that they can find even more information if they need it. And yeah, that's a quick summary of my project.
Okay, so like I said at the beginning, my project is a partner project. I'm working with one of my really good friends, Janai. She's also a D3 student, so a third-year dental student at UAB. And we had the pleasure of having in-person sessions for recruitment for our D1 year, and seeing it. And I'm a little bit more timid than Janai, so she really talked me into it and gave me the confidence that I was like, we can do this if we want to. So our D2 year, we applied because we had a class called Special Patient Care in Dental School that really inspired us to want to help the special patients that may need special accommodations for dental treatment. And so we applied, and when we were selecting our project, we really wanted to make sure we kind of like put feelers out. So something that's really important with being a fellow is having a community center, or I don't know, what's the proper term, Ms. Boggs? Community
Your
partner.
community site, community
Yeah.
site partner, all of that.
And so we work with the Spark Civitan Clinic, which has a lot of different resources within it, but also has a dental office that's run by Dr. Mitchell, and he is one of our mentors. And what we're hoping to do with this project is kind of take a two-step approach. So first, we want to make like a social story video for the dental office, specifically to help patients with autism that come to the dentist, so they kind of can get into a routine and know what they're walking into before they go in. So that is one aspect of our project, is going through making a video and a social story for that, getting that live and getting it out to patients so they can use it before they come. The second part of our project is more focused towards dental students. A lot of dentists in Alabama do not feel comfortable or well equipped treating patients in this special patient population. And so we're hoping to just add to their education in that respect, because as we go through dental school, we only have about 4 days rotating through a clinic like this. And so we can provide and resources that maybe students can keep once they graduate would be helpful. So that is our plan of attack. And like Tanya said, we write goals at the beginning, and they're kind of modifiable. You kind of figure out what reality is once you get in the middle of it. But that's our project and what we hope to achieve, and then how I hope, and I think Janai does too, that we can take it with us wherever we go and feel equipped to treat patients that may need more assistance, more care, or just more attention, and know how to do that, as well as we hope our peers can do the same through our project. So I think that coming into this fellowship, I really thought that this was going to be about service, and it is, and about my project, but it's been a lot more collaborative than I originally anticipated. And I actually am like really thankful for that. And the time that I get to spend with the other fellows in my cohort, and our meetings, and what I get to learn from the people that Ms. Boggs brings in to talk to us about, I feel like has helped me grow as like a leader and a person a little bit, and challenged the way I think and problem solve and stuff like that. So definitely more than just a service project. I think that it really, you will build your own character and leadership abilities out of it, and maybe take that with you when you leave to be able to do things outside of this fellowship. So